The climate crisis is also having a huge impact on public health. The WHO says between 2030 and 2050, climate change is expected to cause around 250,000 more deaths every year from things like undernutrition, malaria, diarrhea, and heat stress. Joining us now for more on how health industries are working to combat the climate crisis is our CBC medical columnist, Dr. Melissa Lem. Dr. Lem, also president of the Canadian Association for Physicians of the Environment. Dr. Lem, good to see you. First of all, what role does health play at the COP negotiations going right now, if any, and what progress do you hope is being made?
Well, you mentioned some stats from the WHO, and the WHO also calls climate change the greatest threat to global health of the 21st century. And when you total up the healthcare costs of extreme heat and air pollution and Lyme disease, here in Canada, it's estimated we're going to be spending an additional $110 billion per year within 25 years if we don't hit our climate targets. And we know our healthcare system is already in crisis, and you have to wonder how we're going to find that extra money. So in terms of COP29, we did see an entire health day for the first time at COP28 last year, and coincidentally today is actually Health Day at COP29, and I'm hoping we see progress on a few fronts. So one is helping the 85 countries, including Canada, that have already committed to decarbonizing and preparing their health systems for climate change, effectively put those changes into place. But as we know, and as was mentioned, progress is not going to happen without funding. This COP has been called the Finance COP because high-income countries like Canada are supposed to sign off on a new funding target to help low-income countries reduce their greenhouse gas emissions and prepare for what's coming. So I really hope we see the Global North hitting that $1 trillion finance goal to help clean up the mess that we've created, because this is not charity, it's actually an investment in a healthy future.
In terms of other solutions, what are you focusing on in your work at the Canadian Association for Physicians for the Environment?
Well, Dan, I've mentioned many times before on our segment that a big focus of mine is nature-based solutions for health, including prescribing nature to patients. Not only are our neighborhoods more resistant to heat and flooding when we have more green spaces and tree cover, but people who have access to nature are healthier physically and mentally too, outside of those climate events that green space protects us from. Another big focus of mine is pushing for policy that moves our energy systems away from fossil fuels like oil and gas to clean, renewable energy. And one big reason is all the air pollution that burning fossil fuels creates. There was a recent Harvard study that calculated that 1 in 5 premature deaths worldwide are due to air pollution from fossil fuels. And in Canada, our number is 1 in 7. So supporting investments in public transit, which reduces cars on the road, bike lanes, speeding up the phase out of gas-powered cars, and making sure that new homes and buildings are hooked up to renewable electricity instead of natural gas, which means cleaner and healthier air indoors and outdoors, are really important.
And lastly, we appreciate your time. Here in BC, we're seeing some of those most direct health impacts from extreme weather events, heat and flooding, the deadly heat dome. What about what's being done here in BC?
Well, we're at the point where we can't adapt our way out of climate change. We need to invest just as much, if not more, in reducing our greenhouse gas emissions. And economists for a long time have been estimating we need to spend at least 2% of our GDP on reducing our emissions. And to date, we haven't come close to that with any provincial budget. That said, the BC government just announced its new cabinet today, and it was really good to see that there's a new ministry called Energy and Climate Solutions that our former health minister, Adrian Dix, is now in charge of. And he switched places with our new health minister, Josie Osborne. So I hope we're going to see new attention being paid to this intersection of fossil fuels and their impacts on climate change and health moving forward.
Dr. Melissa Lem, we always appreciate your time and expertise. Thanks for joining us.
Thanks, Dan.